Thank you, Mr. Chairman. Director Zeller, do you believe that some tobacco products present greater risks to individuals than other products?
Yes.
Okay. On the continuum of risk, do you believe that non-combustible tobacco products are more likely to reduce harm than a smoked form of tobacco for individuals who would otherwise be using a conventional cigarette?
The answer is that it depends upon who is using the product and how they're being used. You can take any non-combusting product, whether it's a smokeless tobacco product, an e-cigarette, and it really depends upon who is using them and how they're being used. If we look at a subset of smokers who are otherwise unable or unwilling to quit, they're going to continue to smoke that pack of cigarettes. Half of them will die prematurely later in life from that decision. If we could get all of those people to completely switch all of their cigarettes for one of these non-combustible products, that would be good for public health. But our job as the regulator is to figure out what is going on at the population level, and it includes the much larger group of smokers, not like the first group I defined, a much larger group of smokers who are concerned about their health and who are interested in quitting. And what happens instead of those people completely substituting with a non-combustible product, they start using both. And then along the way, they wind up being less interested in quitting. Well, then we would say that that might not be good for public health, and our job is to figure out what the net of all of those possible behaviors, including any initiation, which would not be good for public health, and then try to make regulatory policy on top of that.
So, Mitch, for the adult that chose Nicorette 5 years ago, and they chewed the gum, and then they went out back and they had a cigarette, and they couldn't smoke at work, so they chewed the gum, and they went out back and had a cigarette. Does that mean that Nicorette's not a useful tool for that individual? It's only a useful tool if that individual uses it to quit?
Yeah, I would absolutely concede that any of these products at an individual level can do good. What's challenging for all of us dealing with the law that you gave us the responsibility to implement and enforce is the decisions that we have to make are not going to be made about what might be good for the theoretical individual. We have to have regulatory science to support decisions that inform what's happening at a population level, and so we have to look at all the possible behaviors.
If your trend line is this way, then the public health effect is better. You've got less people using combustible products. You've got more of those individuals that have either quit or they've gone to a reduced harm product that's good for public health. And let me just say for the record, CVS eliminated their cigarettes. CVS still sells patches, Nicorette gum, probably all of the pharmaceutical products that Chantix and others that aid in eliminating or reducing the rate of smoking. It's not like they threw out the whole category. So take the retailer that sacrificed some large amount of sales, they still believe